That's the muscle, that supraspinatus. That's the one that's commonly injured when people have rotator cuff injuries. Athletic injuries, of course, will be at the end of chapter 10. There's certain athletes that get rotator cuff injuries. Repetitive use of this shoulder right here, like circumduction. Baseball pitchers often get rotator cuff injuries. Swimmers often get what? Rotator cuff injuries. If you're using your shoulders repetitively a lot, you get the rotator cuff injuries. Like I said, they're called SITs. Supraspinatus, infraspinatus, teres minor, and your subscapularis. The most commonly injured one is this first one right here, when your shoulder is abducted, of course, and if something heavy falls on your shoulder, it's going to cause dislocation of what? Your shoulder, which is on your final exam. Normally when you have dislocation of the shoulder, now guys, I'm recording this, okay? When you have dislocation of the shoulder, the head of the humerus typically will come out of the glenoid cavity, all right? You can have a partial dislocation or you can have a complete dislocation. Okay, when kids, okay, their shoulder joints are not strong, the bones haven't fully ossified, you got a 2-year-old, you're dangling them in the air, this can come out of that. You take them to Children's Hospital, they pop it right back in place. It's going to hurt like crazy. They will probably scream for dear life, but when you're tugging them behind you, when you're in a hurry, you can pull the shoulder. This is the weakest joint, and this is the most common joint that's often suffering from a dislocation. Dislocation of what? Your shoulders. All right? Does that make sense? Okay, let's keep it moving. Blessing, have you done one? Diamond, do knee extension and knee flexion.
This is knee flexion when you pull it back, and then knee extension is just when it's straight.
Okay, you got to tell me what muscles are involved.
The knee extension is the quadriceps femoris.
Okay.
Here,
Mm-hmm.
and then what's the other one I did?
Knee flexion
is the hamstring,
mm-hmm.
which is back here, and it's the biceps femoris, semitendinosus, and semimembranous.
Well, and what else, since we're at it? So you can get some extra points on your test today for going beyond the call of duty. What did you say? The biceps femoris, semitendinosus, what else? Who else knows? Y'all got y'all study guides? You're looking at them?
Yeah,
the what?
S-A-R-T-O.
Oh, the sartorius? Yeah, well, sartorius, that's the longest muscle in the body, remember that. It's called a Taylor's muscle. I need to know the muscles that make up the hamstring because there's several of them. Semimembranosus, semitendinosus, right? And biceps what? Femoris. So you did hip flexion and knee flexion. And what else? Knee extension, right? And see, the thing about it, they were asking me on yesterday, how did you do your knee flexion? Yeah. Because when you do it like she's doing it, you can really feel your hamstrings tightening up. In the book, they're doing it this way. I really can't feel anything back here, but if you just know that your hamstrings are working, that's fine. But I like to do it like she did it because you can feel the hamstrings, tensing up. All right? Extension, you did knee extension, right? Now, what muscles are involved in knee extension? Quadriceps, right. So this is knee extension as well. When you kicking a football, you can feel your quads tightening up. When you're in a zero position, you really can't feel them contracting, but hey, they're responsible for what? Extension of the knee. But when you do this movement here, you can actually feel them tensing up, all right, which is knee extension as well. So I'll try and do them I know you're doing them the way they're done in the book, which is fine, but sometimes there are other ways that work better. Blessing, do hip flexion and hip extension. Absolutely. Okay. What muscle is involved when you flex your hip? Right. Good. Exactly. So when your hip is extended, even when you're hyperextended, your gluteus maximus, those gluteus muscles are working too. But like she says, the gluteus maximus is working. That's one of your sites for intramuscular injection. Remember that if you are going to be giving shots to people. So you need to know where your gluteus maximus is. The gluteus maximus and the gluteus medius, those bulky, thick, meaty muscles, they don't have a lot of blood vessels nearby or nerves nearby, which is typically the site that you will get shots in, which is here in your buttocks. The vastus lateralis. The vastus lateralis belongs to what group of muscles? Your quadriceps, right? Vastus lateralis, which is another site to get intramuscular injections. Typically, the vastus lateralis, babies typically will get shots right here in that particular muscle. Elderly people will get shots in that muscle as well.
I have a quick question, if you don't mind. The gluteus maximus is this big one.
That big one.
The medius is that.
Yeah.
The minimus, in the picture, it kind of looks underneath, but is it just deep?
It's deep. Yeah, that's why I was like, the medius and the minimus is kind of deep, which is really, but you can kind of feel them. If you do it right, you can feel those deep ones tightening up too, you know? Okay, who's next? No, let 3 more people come up here. Willie, Tremaine, and Leslie. They're like, oh my God. So they've done ab and adduction. Leslie, do, let's see which ones we haven't done. Finger flexion and finger extension.
This is finger flexion. I'm using my extensor digitorum muscles, and this is finger extension.
Wait, you extensor digitorum for flexion?
No, for extension.
Okay, yeah.
And then finger flexion.
Okay. So you're using your flexor digitorum when you flex. Yeah.
And then extend. Okay. Yes.
Extensor digitorum. You can, like I said, you can palpate the tendons here when you extend. Tremaine, do thumb flexion and thumb extension.
This is thumb extension?
No, it ain't either. That's abduction.
I got confused on that one.
You got confused on it?
Like we're in an anatomical position.
Right. Yeah. And okay, bring your thumb in. Yeah, because when it's out like that, you're doing abduction. You're doing radial abduction, actually. Yeah. Willie, you know how to do thumb extension? All it is like this. Your thumb is already extended, right? Yeah. It's in the 0 position. So when your thumb is extended, what muscle is working?
The opponents, pollicis.
No. We can't use flexion when we're doing extension now. You only use flexor muscles when you're flexing and extensor muscles when you're extending. Blessing, somebody? When you extend your thumb, what muscle do you think you're using? Extensor pollicis. What does pollicis mean? Your thumb, right? So when you extend your big toe, what muscle is being used? What's the word for big toe? Hallucis, right? Okay. Hallucis is for Pollicis means thumb. Pollicis equals thumb. But I'm just going to ask you the ones in bold. I'm just trying to see if you've really, this is your great toe, as your book calls it. The great toe or the big toe. Digitorum, digitorum. Because Leslie just mentioned the extensor digitorum. Digitorum means fingers or toes. All right? When you see the term digiti, digiti is going to be one finger or toe. Okay? Digiti. That's what that means. All right? So yeah, you're going to have the extensor hallucis that will allow you to do that. So do flexion of your thumb. Tremaine, what is going on with you?
Like those, that was the main one that confused me.
Do they? I don't think they're doing these in your book, but don't they have a write-up or a reading? That's why I was telling the students the other day, I says, you guys are going to have to read the text too. Don't just look at the pictures. You're going to have to read what? The text. I think it mentioned something in the reading about flexion of the thumb, right?
Yeah.
Okay, let's go to the fingers, the hand. I don't see it in here. They have radial abduction, palmar abduction. Yeah, flexion of the thumb, which is on page 296. Flexion of the thumb is bending the joint, so the tip of the thumb is directed towards the palm like that. Okay, and extension is straightening what? The thumb. Okay, who's next? Okay, Willie, do radial abduction of the thumb and palmar abduction of the thumb. No, listen to what I'm asking. Do radial abduction of your thumb and palmar abduction. Face them. Do palmar abduction. Is that palmar abduction? How do you do palmar abduction? I showed y'all earlier. When you're doing that, it's sort of, you're about to go into opposition. Yeah. So this is what? Palmar abduction. Now do radial abduction. Yeah, you take it to what? The side. Where's the radius? The bone, the radius. Uh-oh. Let me take these glasses off so I can see. Palpate where your radius is. Is it on the thumb side or the pinky side? What's on the pinky side? Okay. Some people are over here. This is not your radius. This is your what? Your ulnar. Leslie, do thumb opposition.
This is thumb opposition. And you're using your opinions policies.
Opponents.
Opponents.
Yeah, opponents equals what? Opposition, right? Tremaine, do shoulder circumduction and finger circumduction.
Shoulder circumduction.
Okay.
Finger circumduction.
Good. Willie, mandible depression, mandible elevation.
Elevation or decrease is right.
What? See, you got to do it. Now, y'all gonna have to do. You can't tell me what it is. That's why you're doing them. I need to know you know how to do them. What? Wait a minute. Okay. So Leslie, you did what? Opposition. So you guys know opposition, right? You're touching what? Your fingertips. Okay. Willie, you were supposed to be doing mandible depression and elevation.
Depression is like,
Okay, you got to do it now. You can't.
okay, it's like mouth closed and elevation is open.
Okay, open your mouth. Okay, thank you. You got to do that for me, Willie, all right? So what muscle? So when you depress, you're just bringing it back to really the zero position. When you elevate, it's like you're opening your mouth to receive food. What? Which one? This is what? Depression?
Depression is going down.
Yeah. Yeah, you know. Yeah. Depression, elevation. So when you're receiving food, you open your mouth to take a bite of food, you what? You open, right? What muscles are involved? There are several chewing muscles that will allow us to do that. One particular muscle, which I didn't put on your study guide, is the digastric. When you open your mouth, like some of you do in here, taking a really big yawn, like what she's doing, your she yawned right on time. The digastric muscle is the one that allows you to take that big yawn. But your medial, your lateral pterygoid, Leslie, do lateral excursion of the mandible.
Oh, you move your mouth.
Yeah, that one's kind of hard to do when you twist it. Yeah. So lateral excursion, that side-to-side movement of the mandible, like when you're chewing gum, there are two muscles, the lateral pterygoid, the medial pterygoid, okay, that allows you to what? To do that. Your temporalis and your masseter are also involved because there are actually 4 muscles involved in what? Chewing, okay? Y'all want to keep on? Or y'all want somebody else to come up here? Well, Tremaine, Tremaine, you need to do another. Tremaine, do hip, did we do abduction? Do shoulder protraction and shoulder retraction.
Shoulder protraction.
No, you got to do it like in the book. You're not doing that.
Forward.
Tremaine, wait, did you study? Because I would hate to give you an F.
No, that's what it is.
That's not how he's doing it in the book. Because he.
Oh.
And then you're doing a lot of compromise. But anyway, never mind. Do it again.
But his shoulders are going forward.
Okay. Now, how would you do retraction?
It's going backwards.
Blessing, you didn't study with him? Blessing, do retraction. Leslie, do retraction. Shoulder retraction.
You bring your shoulders back.
You got to do it now. You got to poke that chest out now. Because if you're not poking that chest out, I'm marking it wrong. Isn't he doing this in the book? Yeah. So when you retract your shoulders, what muscles are involved? Oh, God, I can fit. Well, I went to the gym yesterday. Trapezius, big old trapezoid muscle. You know what I mean? Blessing, what are you laughing at? Yeah, so when you do protraction, what muscle is involved?
It's the pectoralis minor and the anterior spine.
Serratus anterior. Really, I just want you to know the pectoralis major and minor. So when you're doing this, you know when you're in the gym and you're reclining on a bench and you're doing this movement here, okay, you're working your chest. So if you want your tatas to sit up, that's what you do. All right? Or they may have you doing something like this. And you can feel your chest tensing up when you're doing it. Okay? So yeah, protraction. What other exercise, Scott, since he's an athlete, you can do where shoulder protraction and retraction is involved? It's in your book. You know, what are you about to say? Willie? I just did a bench press. Caritza. Push-ups. So when you go down with the push-up, what are you doing? Retracting, right? When you come up, exactly. Push-ups. Yep. That can work your chest too. Can also work the deltoid muscles too. Next one. What am I missing? Tremaine, do shoulder elevation and shoulder depression. I forgot to put depression on here.
Shoulder elevation. You're lifting your shoulders and shoulder depression.
That's all you need to say. So when you do shoulder elevation, what muscle is involved? The trapezius, right? Because that trapezius kind of starts right here and goes all the way up here. And also there's a muscle called the levator scapulae. Levator elevates. It's called the levator scapulae that allows you to do that as well. Leslie, hyperadduct your fingers.
Hyperadd with the D?
Mm-hmm.
Okay.
Yeah, like you're crossing your fingers. Do hyperadduction of your ankle. Yep, cross your ankles. Willie, do ulnar flexion of the hand and radial flexion of the hand. Okay. I don't like it this way. Do you wave at people like this? I like it this way. Which one is this one? Okay, good. Ooh. Tremaine, do shoulder protraction and retraction. Why do you do this before you do it? It's like you have shoulder pain or something. Kind of, okay. That's fine. Okay. Maybe I won't let you do that movement. Are you in pain now?
Yeah, like I'm sore.
You've been working out?
Yeah.
Oh. You should have saved that for today. You got to work out for me in a few minutes. Why's she laughing? Really? Y'all are going to be exercising. And it's so funny because these movements that you guys are doing over here, guys, they're called actions in Chapter 10. They're called actions because there are muscles involved. That's why I've kind of combined them. So they're calling them, you have joints involved over here. What? You have joints involved over here. And in Chapter 10, you have what? Muscles involved. So you're doing synovial joint movements. Those movements in Chapter 10 become what? Your actions. Right? Okay. Will he do supination and pronation of the forearm? What muscle allows you to supinate? Supinator, right? What muscle allows you to do this? Pronate. Bless you. What muscle, guys, allows you to pronate? Pronator teres and pronator quadratus, right? So when you're lying in your bed on your back, what position are you in?
On your back.
Supine, right? So when you're lying on your tummy, prone, exactly. Same thing. Supine, supination, prone, pronation. 3 more. Thank you, guys. Y'all are probably tired of standing up here. Can I have 3 more? Okay. Caritza, Jasmine, And no, just don't go blank when I take you across that hall. Ernisha? Okay, Jasmine, I want you to do protraction of your mandible and retraction of the mandible.
Protraction would be like biting down, like my mouth out, and then retraction would be like as if I'm pulling it back in, like.
That's a hard one, isn't it?
Yeah, I think about it like you bite down on something and then you start chewing what you have in mind to bite.
Just sticking out.
That's not protraction. Who knows how to do protraction? Yeah.
Yeah.
But yeah, that's a hard one. And retraction, you take it back. Yeah.
So it ain't my lip, it's my chin.
It's your mandible that you're. You do internal rotation of the shoulder and lateral rotation of the shoulder.
Internal rotation of the shoulder.
Turn around so they can see you. See, there you go. Would it be? You can't, no. And another thing, you guys can't help each other out.
Because like in the book it says medial rotation.
Either or.
That's what I was thinking.
So I may say either or. It just depends on how I'm feeling.
Lateral.
Okay, wait a minute. Do lateral again. Now make sure you keep your shoulder and your elbow close to your body and go out. Don't do that. Okay? Just kind of do that. Because your shoulder is spinning around in axes. So you got to move it's your shoulder you're really working. And then this is what? Medial or internal, lateral or what? External. Yeah. Okay. So when you do medial rotation, you got to tell me the muscles involved for medial rotation.
The pectoral is major and deltoid is anterior and with lateral deltoid posterior.
Good. Very good. So yeah, your pecs are working. This muscle right here, the anterior deltoid, when you go in, out. The one back here is what? Working. Ms. Webb, do internal and external rotation of the hip.
Okay. Internal.
Not the trunk. The hip.
Internal.
Which is medial.
Okay. Good. External. You turn it out. Like your pigeon-toed. Your pigeon-toed, you take it in, right? And then you take it out. What muscles are involved in medial rotation? You do this. Ooh. Feel it.
Medial rotation.
It's the posterior.
Adductor muscles. Yeah, these muscles right here. Yeah, they're right here. What muscles are involved when you adduct your hip? You go from abduction to adduction. When you do adduction, when you do this. What? Adduction of the hip. What, Scott?
Adductor brevis, adductor longus, and adductor magnus.
Yeah, that's a test question on your final exam. All of these muscles right here, they're right here. People that suffer from a pulled groin, which is common in cheerleaders that do splits, athletes get a pulled groin, all of these muscles right here. I like to, when you're working out, in the gym, they may have you doing something like this. you're working these muscles right here. The adductors are right here on the medial aspect of your what? Your thigh, okay? So they're right here. These are the muscles, the pectineus, the gracilis, adductor magnus, longus, brevis. Magnus means large. Brevis means short. You may want to write that down. Longus means long. Adductor magnus, brevis, longus are the muscles that you can actually injure cheerleaders when they're doing splits. It's a common injury, they talk about a pull groin at the end of what? Chapter 10. Okay. Jasmine, did you just do, well, I'm going back. Jasmine, do flexion of the trunk and extension of the trunk.
Flexion of the trunk will be leaning forward and extension will be standing straight up.
What muscles are involved?
Bending down is the six-pack, the abdominis,
the rectus abdominis, right?
Rectus abdominis, that's the one, flexion. And then extension is the spinae, see, they there, but erectus spinae, yeah.
Now y'all know I'm going to take off for y'all not knowing these muscles now. Because there are only 30 you had to know. So, I got to mark it wrong, guys. I got to mark it wrong. Okay, so erector spinae keeps the spine erect, right? Erector spinae. They're called slim muscles. If you find them in chapter 10, they're all like going straight down your back, and they're all right there together, and they're really, some of them are really, really thin. That's why they call them slim. You have the iliocostalis, the multifidus, the longissimus. All of those are erector spinae muscles. Spine erect.
Is it going to be at the bottom part of your back? Or is it
Mm-mm.
here?
Nope. The erector spinae muscles, those muscles like go all the way down. Yeah. So when you come up from this position, your erector spinae muscles. The thing about, let me just say this about those erector spinae muscles, which of course I think is on your final exam. A lot of people, when they bend to pick up an object, how do they bend? Like this, right? Heavy lifting, if you're not bending properly, these muscles can't contract to their fullest capacity, and what's going to happen, you're going to have it involved. What's going to happen, either that ligament is going to get torn, you're going to have a muscle spasm back here, you're going to injure the tendon, or you're going to suffer from a slipped disc. Okay, when you're doing this. You're supposed to bend like this when you're lifting, right? So you're supposed to use your thigh muscles, and you're supposed to use your butt muscles, the gluteus maximus, when you're what? You're lifting. Always bend at the knee. Like I said, the most common cause of back injuries, people not lifting properly, doing this and lifting. You're not supposed to do that, okay? Can lead to what? Back injuries. Okay, flexion of the trunk, what muscle?
Wait a minute. No, we said flexion or extension. Flexion is your abdominals, your...
What comes before
I
abdominis?
keep forgetting, rectus abdominals.
Rectus, right? So when you're doing what? Crunches, what are you working?
Your rectus.
Rectus, guys, means straight. Okay, so to get that six-pack, you're going to have to do probably thousands of crunches every day. Okay, so you're going to have 3 little muscles over here, 3 little muscles over here, and then you have what? The six-pack. Like Morris Chestnut had in Best Man Holiday. Yeah. So, rotation of your trunk and rotation of your head. Okay. Wait, because see, you're doing this like all like lackadaisical, like
trunk.
Okay. Why are you like? What muscles are involved when you rotate your trunk?
The
Right and left.
It's kind of oblique.
Those obliques right here, right? So if you want to get rid of that muffin top and you want this right here to start going in, you want to whittle your middle, okay? What do? You got to rotate that what? The trunk, right? Okay. What muscle is involved when you rotate your head? We do these movements every day. That's sternocleidomastoid. Absolutely. That's the prime mover of what? Rotation of your head. I think y'all know that sternocleidomastoid muscle. Caritza, do dorsiflexion of the foot and plantar flexion of the foot.
Dorsiflexion is that it's like when you're polishing your toes.
Mm-hmm.
And then plantar flexion.
Like you're on your tiptoes. Okay, now you got to tell me the muscles. So guys, when you do your first movement, tell me the muscle involved if you've got to know the muscle. So when you dorsiflex, what muscle is involved? The tibialis what? Anterior. Okay, you can feel it. Well, it's a small muscle, but it's located on the front of which bone? This bone right here, the tibia, right? So when you take that foot and you tilt those toes up like that, this muscle right here is going to contract, which is in front of what? The tibia. So when you plantar flex, you're standing on your tiptoes, what muscle is working? Tibialis posterior, and what else? The main muscle that's working when you do this, guys, is your gastrocnemius. Doing this in the gym is working what? Your calf muscles. What is that tendon that runs from your calf muscle down to the calcaneus? That's a question on my final exam. The Achilles tendon or the calcaneus tendon, right? Has anybody ever had a torn Achilles tendon? Scott, you? Nobody? Okay. So, if I injure my Achilles tendon, what movement will I not be able to do? Well, yeah, I'll probably be on crutches. You just did. What are you talking about? Bend your leg.
Oh, I thought you were talking about the calf.
Well, your Achilles tendon is back here. So if it gets cut, yeah, which is what's that? Right. Plantar what? Flexion. You won't be able to do this. Okay? I'm asking you guys these questions. It's kind of like a review for your final exam, too, because I know there's a question about the Achilles tendon in your final exam. Jasmine, do inversion and eversion of the foot.
Inversion is like this. You put my feet upward.
Wait. Okay, just do one.
Oh, well, that way.
Okay, what's eversion?
Like this.
Like that, right?
Yeah.
Inversion. It's also called supination. So when you get fitted, where's that place in the bike rack somewhere? When you get fitted for special gym shoes, they will tell you if your feet are pronated or supinated, and they will conform that shoe to your foot. So inversion and eversion is a form of pronation and supination. Inversion, it's like you're turning your soles inward. Eversion, you're turning them what? Out. Okay? Does that make sense? So you guys ready? I think I did most of them, didn't I?
Do the mouth again. It's my chin. Good.
Do it like, look at how he's doing it. It's your mandible. You see how he's doing it? It's just hard. It's a hard one to do. It's not your lips, it's your mandible.
I'm just do this.
Yeah. Mm-hmm. I think I did them all. Okay, somebody else come up here. There's one more movement I need to do. Simone. You guys can do it. I have faith in you. Do lateral flexion of the trunk. Okay, yeah. What muscles are contracting? What are these? When you do that? Mine are sore. I went to the gym. What are these? Remember the muffin top? Remember? When you do lateral flexion, hey guys, when you do lateral flexion of your trunk, what muscles are involved? Your obliques, exactly. Do lateral flexion of the head. Tilt it to the side. Good. All right. So you guys are ready. So who wants to go to the hot seat first? I will be taking 2 students at a time. So what's going to happen, because Dr. Wilson is coming in here at